Well, the Idaho Medical Association is calling for an investigation into Dr. Ryan Cole of Boise. If his name sounds familiar, it's because Dr. Cole, who's a pathologist, he was recently voted to the Central District Health Board of Directors as its lone medical physician member. Now, as we've reported, Dr. Cole has called the COVID vaccine, quote, needle rape, and has publicly advocated for the use of ivermectin, which is an unproven method to treat coronavirus. Now, last week, Dr. Stephen Kohtz, who's the president of the Idaho Medical Association Board of Trustees, as well as Susie Keller, the CEO of the Idaho Medical Association, well, the pair, they sent a letter to the Idaho Board of Medicine asking them to investigate Dr. Cole. Now, in the letter, they say, quote, Dr. Cole has made numerous public statements in 2020 and 2021 concerning COVID-19 that are at significant odds with commonly understood medical treatment of COVID-19 and fail to meet the community standard of care. It goes on to say, we believe many of those statements to be profoundly wrong, unsupported by medical research and collected knowledge, and dangerous if followed by patients or members of the public. Many of those statements have advocated that people not be treated appropriately and undoubtedly have led to and will continue to lead to poor health outcomes as people are encouraged not to be vaccinated against COVID-19 or obtain appropriate treatment for it when such treatment could improve their health. Taken as a whole, Dr. Cole's statements and actions have significantly threatened the public health and, in our view, are erroneously irresponsible and injurious to the public. Again, reading there from their statement. But they say that the basis for their complaint isn't his statements or his views, but that, quote, says that he has treated patients from Florida to California by refusing to use accepted and documented medical practices and vaccination instead of prescribing ivermectin, while he has criticized those who advocate vaccination against COVID-19 for violating their ethical obligation to first do no harm. In fact, he likely has violated that very ethical admonition by advising against vaccination and promoting the use of ivermectin instead. We believe his practice, has described it himself, is not in keeping with the Idaho community standard of care and does more harm than good. It should be stopped, end quote. Again, all of that from the statement. Now, this does not mean that Dr. Cole is under investigation, only that the Idaho Medical Association has asked for one. So what happens next? The complaint will be on the agenda at the next board of the Idaho Board of Medicine later this month. And at this point, members will decide if they want to recommend formal action or dismiss the complaint that you just heard as a whole. We did reach out to Dr. Cole for comment. We have not immediately heard back, but if we do and when we do, we will add his response to the story on our website, ktvb.com.